I'm here with Kevin Johnson. He's a partner at Medicxi, which he co-created last year out of Index Ventures. He started his career at Cambridge Antibody Technology on the platform that became Humira, or sorry, not platform, project that became Humira, before moving on to Index, and I think it was 2003. So I guess my first question is, why did you move into investment instead of entrepreneurship?
Oh, do I have to talk? There's a toy microphone. Okay. So actually, it was an accident, but I was trying to think of how to make it interesting. So I decided to do an experiment. Sorry, I need to hold it closer, do I? Okay. Do an experiment, which was I decided that I was only going to work with people I liked, right, and hang the rest of it. I don't care. I'm just going to work with people I like. So the reason that arose is I tried to spin out a company from CAT, which had no venture capital in it at all. So it was all the money was bootstrapped and raised from what are now known as hedge funds and long-only funds, mainly in the US. And there was no institutional venture capital. Secondary position with 3i, but that was it. So I hadn't really become exposed to VCs until I tried to spin out a company. And I spent a long time working out what would make sense as a business, and it fell completely on its backside when I went to talk to VCs. And so clearly I didn't understand something. So I decided to call a halt then, and I left. And I just went and started hanging out with VCs who I'd actually had quite a laugh with when I was trying to spin this thing out. I mean, even though it was ultimately terrible, it was actually quite a fun process. So I went and hung out with a few VCs. And in order to find out what I didn't already know, and in the process of doing that, I started hanging out a lot in Geneva, which was where the Index Ventures office was, and I found people who swore more than I did, which was actually quite an unusual thing. Still to this day, it's quite an unusual thing, and I thought, actually, this is pretty cool. And so I started hanging out more and more. And then you become an accidental investor because basically you just get sucked into this gravitational pull. You get involved with what's going on. And the thing that really strikes you as a difference between being a freestanding entrepreneur from being in a venture fund is that the amount you see is like at least one order of magnitude more. Right, I thought I was well informed when I was at CAT, right, because I used to speak to lots of companies. I was going to loads of conferences. I thought, basically, if anything's happening, I'm going to hear about it. Actually wrong, because there's stuff that's over the horizon that just doesn't appear in any of the normal fora, and that you find out about, because most people, if they're trying to do something, they're trying to raise money to do it. So that's where you find out. You're already plugged into that. So the short answer is it was to do an experiment with people I liked, and I liked everybody at Index. So I thought, right, okay, I'm happy here. It then became an accident, but it actually was a fortunate accident because I can do way more stuff as a VC than I can as a freestanding entrepreneur. Although I still do both, but your leverage is much higher. Long answer, short question. Sorry. Yeah. It's not a toy then, is it?
No, it's definitely not. I think it doubles as a stick for beating people into their seats. So I had another question on the cycle that venture capitalists typically have to work with about why it's 10 to 12 years. But you brought up that you were avoiding VCs, and I was curious what the reason for that was, besides that you might not have liked the people.
Okay. So we didn't actually avoid VCs when we were starting CAT, which became MedImmune, which is probably the one that's looking at the antibody production process. Is actually no VCs were interested. So we were doing antibody. Now antibodies are a big deal, okay? And the surprising thing is they've stayed a big deal for over a decade now. But the time when we started this, which was in the 90s, I mean, I think some people were born in this audience back then. But basically, this is at a time when the entire market for therapeutic antibodies was $200 million. Right, that was it. The world market was OKT3. It was $200 million. You try raising $50 million when the entire marketplace is 200, right? You are not going to get very far. And so they were just deeply unfashionable and lots of problems associated with them. So basically they wouldn't come in, okay? The reason it's a 10-year fund is actually because it's a packaged financial product. It's a really boring answer, right? So when you're selling a financial product, so basically people, I hope people have pension funds and whatever, right? You are buying a packaged financial product. It's arbitrary, but it is one that's sort of 10 years is still a bloody long time, by the way, right? So that if you think about the length of your professional life, it's probably 40 years. Okay, so there's only 4 of them in that, so it's still quite a long time nonetheless. But the reason it doesn't jive with the drug development cycle is it was actually never intended to. It was really for other things, but it's a packaged financial product, and that's what if you look at the funds that are in us, it's pension funds, insurance companies, endowments. That's the sort of product that they buy. So they have a certain allocation for high risk investing. They think 10 years is quite long enough. I mean, you can try and market a 20-year fund, but I don't think there'll be a lot of takers for that. So what you have to do in life science generally is to work on bits of it that will fit inside that 10-year cycle, and then you also have what are called extension periods. So normally you can get at least 2 of those. So you can make it 12 if you really have to. But actually, if you're out there, you're in pain. Okay, it is really, the one of the VCs that I worked with some time ago got it right. He said working with a VC is 5 years, then divorce. It's a marriage for 5 years, then you've got to be divorced. If you're not divorced after 5 years, you'll feel like you want to.
I see. But you mentioned how difficult it was to launch CAT into the world. Is it your sense that it's gotten any easier for biotech since then, since this massive success story?
No, I think it stayed about the same. Right? I mean, people say that it was easier then, or it's easier now, or it's something in between. It's so dependent on individual circumstances because the whole thing is anachronistic. So the thing that's bizarre about a venture firm, and I say that working within one, right, is that it's actually very few people, right, and it's a partnership. They tend not to have a typical. They don't, some of them have a CEO type, but most of them work like ours does as a consensus organisation. That's a really weird sociological structure to try and do business in. But what it means is they're all a bit weird. So, if you just basically, if you're the right kind of weird for one fund, for one firm or one set of partners, then you can get something away. And there are lots of things that we see, beauties in the eye of the beholder, that we've seen, this is just brilliant, right? And they've sucked wind with every other VC they've spoken to. And there are some that we don't like that somebody else likes. And it's because it's all very, it's small and unusually formed, I would say.
Could you then give examples of the most beautiful thing that you've ever seen, and maybe the ugliest thing that you've ever seen?
Oh, God. Okay. These are all going to be operational definitions because my value system for what's beautiful and what's not is going to be governed by what I need to do to satisfy my investors. And probably the most beautiful thing I've seen recently was a deal that we did in San Diego last year, which was a cancer drug that was being developed by a pharmaceutical company that for market reasons we believe they pulled. So they put it on to clinical hold and stopped it. And long story short, that was restarted by the guy who invented the drug, and it's completed phase 3. But it's basically it looks like a small company, but it's got a late stage thing. And actually, we're talking to the FDA very shortly about a path to an NDA. So we're a bit nervous. But the thing is just this is going to have a huge impact in a very short order. So that beauty in the eye of the beholder, That's, I would call that beautiful, based on my operational definition of beautiful. Ugly, these are things that were hot at the time. Nobody wants them anymore. and actually they are, in some ways, the hard things are sector related. I think that we've had things. I've got a good one there. There are multiples I could pitch as ugly, but there's one really good one where basically we were $11 million into a company and it was all an artifact. I mean, it was just remarkable. But actually, it changed our behaviour. We learned from it. That was at the time. That was more than 10% of our fund, because we had a small fund at that time. And what it was that the instrument used to do all of the measurements was one instrument. It was an old one in the basement of some god-awful university somewhere. And as soon as, and actually everything worked bloody brilliantly when we were doing these experiments in this thing, until we started to try and move it around, and do things elsewhere. And then nobody could repeat it. And it turned out that was actually down to, it was just basically an instrument and a lot of optimism from the operators. So it's actually why now, and this is obviously a big thing, Journal of Unrepeatable Results. It seems to be a big thing now, and we see this from the people in pharma that we talk to, that like they say that roughly half of the experiments don't repeat when they try and test them independently. It's why the first thing we do is we basically we do repeat them externally, and in the end, this sounds like it's harsh and we don't believe you and blah blah blah, but it's best for everybody, because the opportunity cost for chasing down this thing. I mean, somebody just burnt 5 years of their professional life on this crap. Okay, we've burnt $11 million, but it's not been 5 years of our life. Okay, and I think they paid the high price. So the more I've done this and the older I get, the more I value opportunity cost. I think that's really, if you just work on the basis that you have a finite span where you're going to be doing any of this. Right, you just use it well, and unrepeatable results, just not using it well.
On the topic of pretty and ugly things, Medicxi is an asset-centric company. But so what does it take to make a platform attractive for you guys?
Okay. Yeah. So this is a tough one. So what it takes So the problem is that most platforms take a lot of cash before you get anywhere, before you can use them in anger. That's the basic problem, and I don't care what it is. You are going to invest a lot of money before you're battle ready. And Humira was a good example of trying to get something done before it was battle ready. I mean, we were so strapped for cash, we basically needed to get this bloody thing out the door, and it was very, very hard. The technology wasn't ready. So all the stress we had with that program, and I had a lot of it, was because it wasn't ready. So, you're always going to be trying to get it out sooner rather than later. You're always under pressure. I think that's fine if you're coming in, if you're opening up a whole new area of science and that you think you have line of sight on transformational products. Right, so this is what makes it attractive. So this is what makes people wait 4 or 5 years or whatever it's going to take in order to get that done. Because basically they're believers, they're already in the church with you, and we're believers in this thing, and it's going to make a big impact, blah, blah, blah. Right, that's what I think it will take. And then there's value in the platform as well. Because the other thing that affects it, and if you think like an investor, and I do encourage people to think like an investor, if it's your own money going in this, how would you feel about it? And actually, the even better way is put money in somebody else's company and say, how will you feel about it then? Because incidentally, part of being a VC, you put your own money in it as well. Okay, so it is. So it's not really a theoretical exercise. And then you probably really brings it to a point that the technology cycles in value. Right, some years it's hot. Right, and you can sell loads. You can just sell the technology potential. Other years, nobody wants to know, right? But the only thing that in the end that fundamentally does add value is the products that are going to come off it. So, there is no substitute for an early win out of these things. So if you can get an early win, even if it's just like only tangentially related to the platform, that's potentially really valuable. But for it to be investable, people have to see a really big pot of gold, because the rainbow's a long way away, I think.
My last question before handing it over to everyone. So Jean-Paul Clausel at Bioequity Europe this year said to a sizable audience that A-grade management and B-grade and technology is better than B-grade management and A-grade technology. Do you agree with that?
I think I know why. No, I think it's just too glib, and I like glib things, because you've got to boil things down. But that's too glib, and he's saying that because that's where Actelion came from. Actelion that got invested is not the Actelion that emerged later. They pivoted, so their original technology crashed and burned, and it was stuff that they brought in later that made the company worth a lot of money. It depends which stage you're at. You don't need to be a rocket scientist or have done it many times before, because I think that's what he's talking about. How many miles on the clock do you need to have before you become A grade, right? That would be underselling a lot of people who are doing it for the first time. How do you classify them? They've got no track record. What are they? A, B, C, whatever. I think it needs both. So I think the ideal recipe of people who have domain expertise. I mean, I honestly don't think you get anywhere unless you have the domain expertise. We really like scientists who, truly understand the space that they're developing drugs in. Right, that is just the ideal thing to have. Whether they're good at selling stuff or whether they're good at talking about it, whatever, that's okay. We can, you can layer that on, and it doesn't matter if they've done it before. But the important thing is that A grade management with B grade technology is still a lose, right? That's not good enough. If you've got B grade technology, it doesn't matter how good you are at, occasionally you can sell it to somebody, but that's really sleight of hand, because something's going to explode later. It depends whether you can sell it before it explodes. So that's what that saying says to me. I think the recipe is you need both. But if you've got an early stage stuff, there aren't that many degrees of freedom in terms of how you develop it. It's a very highly regulated business, so there aren't that many degrees of freedom. Later stage, it does matter, I think. So it probably matters more in the later stages than the early. Sorry. No.
So with that, are there questions from the audience? Wow. Do you want to duke it out? Rock, paper, scissors. All right.
Biotech startup nowadays. I mean, there are certain clusters on the planet that are abundant with capital and talent. If you fund your company in Europe, and if you create a company in Europe and you try to fund it here, how much of a disadvantage are you actually not when you are not going to, let's say, Tel Aviv or Boston or San Francisco or all those places? Paved with.
You see, I'm not. I spend a lot of time in those clusters, and I don't believe that you are really at a significant disadvantage, if you're at a disadvantage at all, right? Because the problem with those clusters is actually airtime. So, and if you're not part of the in crowd, right? I don't believe you're at a disadvantage. I think I fundamentally believe if you've got something that's really worth doing, you'll find people who will back you to do it. And it doesn't matter where you are. We don't care where you are, actually. We don't care where anything is. You can't guarantee, you just don't know where stuff's going to come from. And I don't believe it comes necessarily out of clusters, for example. That would be, so I would say none.
It doesn't come out of clusters, but it's made to go to market in the world. So that's the question. I mean, technology can happen everywhere.
Yep.
Everywhere. People are educated everywhere. But
yep.
Actually, the structures to bring that to market, are they localized or are they
We're specialising in companies that have like 2 or 3 people in them and one drug molecule, and then those guys develop the drug molecule using external providers, right, from all over the globe. Right, it doesn't matter where you are, and it doesn't matter where these guys are, right, and that's how I think a lot of people want to work that way. If I was doing this, and I might still, recycle back into to doing it myself again, I would be quite happily do things that way. I mean, I think I've done a build out of a big-ish company, and I think it's overblown, right? The amount of effort you're spending creating these things and then stopping them from entropy from doing its thing, right, in these companies is massive. The amount of energy you put into managing an organisation that is energy you're not spending doing stuff, and you can do stuff anywhere, right? It doesn't matter. It shouldn't matter. I think it's a guerrilla army out there, and I think that's how I would prefer to work. Sorry if they. So I'm not a clusters happen. That's great, but it's not necessary.
Hang on to it.
Oh no, I have to hang on to it, don't I?
Yeah.
So Medicxi are a pretty reputable VC in the life sciences space. Do you think this is, what do you think you do differently? Do you think it's deal flow? Do you think it's analysis or criteria?
What I hope we do differently is actually we do experiments. Right, so the whole asset-centric investing, the thing I was just describing, that was an experiment. So the follow-on from when I started hanging out in Geneva is basically I said that I'm sure that we're spending far too much cash just building infrastructure when in fact there's already there. Why are we putting money into stuff that's already there? That's just we don't own it. Do you need to own it? And so we basically did the experiment. It turns out there are no rules. That you think that there are rules that we've got to operate by as investors. No, I'm regulated by the FSA, but that just means I'm not a fraud. Okay, but it's like financial fraud. So basically, it means that we can do anything we like, really. I mean, if you're doing something really funky and it flops, you've really got some explaining to do. But actually, they're giving you a hunting license to do stuff that nobody else has done before, and that's not a problem. So so doing experiments, and then I think funds should really have more people, not like me, but that have got experience of doing this themselves. When I look at people who've come out of a financial background, they have no judgment of their own. So all the judgment is received judgment. So it really depends whether your idea takes root. Depends on who they asked, right? So they can not come to a conclusion themselves. And what this does is 2 things. One is they spend an awful lot of their time looking at stuff that really should be. You just look at this and you think, no way, right? I mean, you look at it as a scientist or as an operational guy, and you think that's not happening, right? So that's literally taken you 5 seconds to work that out, rather than 5 weeks of farming it out to consultants to opine on. So I think there needs more of that, and I think it needs more people who've got operational experience who can actually understand and help out, because you rarely have everything you need when you're starting out. So it just helps to put a couple of afterburners on, so to have extra brains around the table from people who've done it before, knows what things should look like, and I think that's helpful. I think most people find that helpful. For us, it's not mandatory. I mean, if people can do it themselves, that's absolutely brilliant. But often it's not the case. So I think that I would really like to see more venture funds have entrepreneurs in them. I mean, and I think that probably if you were looking at us, Advent is even more along that extreme, and they got loads of guys who are involved, which I think is a great thing, by the way.
Are there any last questions?
A few companies pricing which are applying a crowdfunding formula to raising capital for life science in Spain and the UK recently. What's your take on that?
think it'll probably end badly. I think if you look at it as a because, you know, when you look at it, you know, the amount of work we have to do to check that something's right and we actually understand the business is, in order to make a big financial commitment to something, is actually pretty large, right? If you're then asking people to make a judgment call, you might as well toss a coin, or if it sounds good, right? It's just not enough. So the chances of them having any stringency at all is very low. So there is no stringency. You're relying on something, you know, a pre-pack to when you, whether you like that idea or not. I just don't think there's it's not the right sort of stringency attached to it. So if you look at what's happened when that's been applied, and there are many examples in history of where that's been applied. Germany is a very good example when they're trying to build up the biotech business. Right, it's that basically you just pour cash in there, and very little of any substance grew out of that. I just think it'll end badly. It would be my personal opinion. But great if you can do it that way. God bless.